Bismillah ar-Rahman ar-Rahim. Your Excellency, Sheikh Nahyan bin Mubarak Al Nahyan, patron of the conference, Your Royal Highness, Your Excellencies, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Rana Luqman. I'm your MC for this evening, and it is with my great pleasure to welcome you to the 16th World Conference in Tobacco or Health. This conference is held every 3 years and is considered one of the largest gatherings in the world of tobacco control advocates, policy makers, researchers, public health experts, and clinicians. Dear guests, it's my pleasure to welcome His Excellency Sheikh Nahyan bin Mubarak Al Nahyan, the patron of conference, to deliver the opening speech. Your Excellency.
Director General Margaret Chan, distinguished guests, global delegates, ladies and gentlemen. Welcome to the capital city of the United Arab Emirates. Abu Dhabi is delighted with this opportunity to provide you with a smoke-free room. Thank you. Like so many other countries around the world that have responded to the bold leadership of the World Health Organization, the UAE is taking unprecedented steps toward a tobacco-free society. It is my distinct honor and privilege to convey to you all the greetings and personal welcome of the leaders and the people of the United Arab Emirates. Under the leadership of the President, His Highness Sheikh Khalifa bin Zayed Al Nahyan, and with the strong support of the Crown Prince of Abu Dhabi, His Highness Sheikh Mohammed bin Zayed Al Nahyan, we have established excellence in healthcare as vital to our national efforts for development and progress. And with the strong support of the Deputy Prime Minister and Minister of Presidential Affairs, His Highness Sheikh Mansour bin Zayed Al Nahyan, we are able to offer the city of Abu Dhabi as the venue for your work. Our greatest fortune in the United Arab Emirates has been that the leaders of our country are people of wisdom and vision. We owe them a great debt of gratitude for creating an environment of commitment, understanding, persistence, and genuine concern about the health of absolutely everyone living in this country. We have reaped the benefits of those attributes, and we feel a responsibility to help other nations capitalize on those same attributes. Please, those who are standing behind us, plenty of chairs, seats here in the front, on this side, this side. You don't want to be standing listening to a long speech. No? Boring as well, maybe. Good. Somebody need to help these people to sit them down. Tonight, who will honor the ruler of our Sharjah Emirate, His Highness Sheikh Dr. Sultan bin Muhammad Al Qasimi, for his remarkable anti-tobacco work and for his attention to the health and welfare of all people. He has been an inspirational to all of us in the United Arab Emirates. His efforts over the years have underscored our national commitment to the notion that a healthy population is fundamental to economic growth and that investment in health must take priority. Our population must be fit and healthy, and every element of society must commit to that priority. This commitment has helped us become the productive, peaceful, prosperous, and hospitable global crossroads that we are today. Ladies and gentlemen, the theme of this conference concerns the health of our global population. It transcends perspectives, jurisdictions, and boundaries of individual nations. The topics on your agenda imply that unhealthy behavior anywhere can and often does have an enormous impact upon world economic development and well-being, and on political stability as well. In this conference, you highlight the global goal of a tobacco-free future. But you experts know better than anyone else the barriers to multiplying World No Tobacco Day by 364. One of our most formidable barriers lies within old habits. Smoking has traditionally brought people together in a relaxed conversation. We have often gathered together to smoke cigarette or even the shisha, and that's when I used to smoke, and to talk. I noticed today that people now smoking outside smoke-free buildings congregate as though the conversation may be as important as the smoking. It may be that as we convince smokers to give up smoking, we should also give some thought to promoting communal conversation by some means other than burning tobacco together. Yes, as soon as we begin thinking about conversation, which is one of the greatest pleasures in life, according to Somerset Maugham, we must acknowledge that such human interaction has already been undermined by our electronic devices. I have seen many number of smoke-free cafes, coffee shops crowded by young men and women, each in silent communion with his mobile. That behavior worries me for many number of reasons. And one of them is that young people might pervasively turn to smoking cigarettes or shisha so as to resurrect the lost art of conversation. If conversation is as important as I think it is, however, we should use it first to convince our youth that they and their community will thrive only if they are in good health. We will be talking with people represented quite well by a young man quoted in the Guardian newspaper article. He said this young man, sure, inhaling tobacco smoke, whether it is from shisha or from cigarette, is never going to be good for you. I know that, but at the end of the day, it is just something I enjoy. despite admitting that it is, and I repeat his words, never going to be good for you, we are unlikely to get him to concede easily that inhaling tobacco smoke is never going to be good for him as well. But if the health of our communities worldwide is going to improve, we must convince each young man and woman that they, each one of them as an individual person, will almost surely suffer sooner or later from heart disease, cancer, diabetes, or chronic respiratory diseases. In my opinion, this 16th World Conference on Tobacco or Health will be successful if it advances civilization firmly toward the educational outcome. I admit that the facts may fail to change the behavior of the suicide few. Nevertheless, I am confident that the grim fact will count with most young people. We must also imagine ways of encouraging a communal culture of the sort that has so often accompanied the act of smoking. The conversation with our young people must move beyond the horrible consequences of inhaling tobacco smoke. To begin with, the conversation could center on new ways of promoting conversation. Our young people are amazingly inventive and will rise to the challenge, especially if they do not need to converse in a smoke-filled room. I know that your conversations over the next 2 days in Abu Dhabi will renew the fight against tobacco. Our country deeply appreciates your dedication and your ingenuity. You have a great deal to do, but at least you do not need to write a poem. Someone in the 19th century already wrote one, and it goes like this: tobacco is a filthy weed that from the devil does proceed. It drains your purse, it burns your clothes, and makes a chimney of your nose. On the other hand, maybe a 21st century poem is what we need. Something, anything that will rescue our generations from the filthy weed is what we need. My hopes are with you. Best wishes for an absolutely smoking-free success. Again, welcome to Abu Dhabi and to the United Arab Emirates. God bless you all. Thank you.
Thank you, Your Excellency. Very nice words. Ladies and gentlemen, will you please join me in welcoming to the stage Dr. Wael Al-Hamid, President of the conference, who will shed light on the activities and events throughout this week.
Your Royal Highnesses, Excellencies, ladies and gentlemen, good evening. On behalf of the organizing committee of the Congress and the Emirates Cardiac Society, I am honored to welcome you all to the 16th World Conference on Tobacco or Health, held here in Abu Dhabi, the capital of the United Arab Emirates. We are honored that this conference is being held in Abu Dhabi, the capital of the UAE. This is the first Middle East convocation for this important conference since its inception 48 years ago. This reaffirms and galvanizes our shared worldwide commitment to controlling the scourge of tobacco. The conference theme of tobacco and non-communicable diseases highlights the fact that tobacco use is a significant factor in the rapidly escalating burden of chronic disease, responsible for 1 in 6 deaths due to non-communicable diseases worldwide. Controlling tobacco is one of the most effective ways to prevent non-communicable disease. An ounce of prevention is worth a pound of cure. Controlling tobacco will save millions of lives and save billions of dollars. We are proud that this conference involves the World Health Organization, represented by the East Mediterranean Office, and the official sessions of the Ministers of Health from many parts of the world. We are also happy that tonight the World Health Organization Prize for World No Tobacco Day will be presented. The conference also includes the awards, the Bloomberg Awards and the Luther Terry Awards from the American Cancer Association for Tobacco Control. This conference will present the most up-to-date research and development in the field of tobacco control from the community to the global level, including the burgeoning subjects of electronic cigarettes, oral tobacco, and water pipe or shisha smoking. The conference includes more than 800 scientific abstracts, 74 symposia, 20 workshops. 400 scholarships brought distinguished delegates from all over the world, and there's a conference for the youth where tomorrow's leaders will learn how to fight back against tobacco. Like every other part of the world, the UAE and the region face major tobacco control challenges. Cigarettes remain the most widely used tobacco product, but we have an also surging regional problem with water pipe smoking and a local problem with the tobacco pipe called midwah. This has enabled addiction to become entrenched among some of the male teenagers and young adults. To combat the problem of tobacco, the United Arab Emirates ratified the Framework Convention on Tobacco Control, FCTC, in 2005, and has made significant efforts to control tobacco, including a new tobacco control law in 2009. Among the regulations that prohibit tobacco advertising, require graphic warnings on cigarette packs, prohibit smoking in public places and on public transport, prohibit smoking in private cars if children are passengers, prohibit water pipe cafes in residential areas, and prohibit the import of e-cigarettes. Finally, I would like to thank the UAE and the government of Abu Dhabi for hosting this conference and for all their support for making this conference successful. I would like to thank the Union and all those working in the Union who have tirelessly played a great part in this conference success. I would also like to thank the organizations locally and internationally that have supported and contributed to the success of this conference. I hope that this conference will result in improving our efforts in tobacco control in the UAE and in the region and the world, and I wish you all an enjoyable and productive stay in Abu Dhabi. Thank you.
Thank you, Dr. Weil. Dear guests, the International Union Against TB and Lung Disease has played a key role in the global efforts to end the tobacco epidemic by building the capacity of governments and non-governmental organizations and individuals in more than 50 countries. The Union and its partners have also been effective in placing non-communicable diseases on the global health agenda and urging governments to adopt effective policies to address the risk factors of those non-communicable diseases. With that, please join me in welcoming Mr. Jose Luis Castro, Executive Director of the Union, which serves as the Permanent Secretariat for the World Conference on Tobacco or Health.
Good evening, Your Excellency Sheikh Nahyan Mubarak Al Nahyan, patron of the conference, Your Royal Highness, ministers and other government dignitaries, ladies and gentlemen. I'm honored to welcome you all to the 16th World Conference on Tobacco or Health here in the magnificent city of Abu Dhabi. Thank you to the Emirates Cardiac Society, which is our gracious host, and to all the patrons that have made possible this conference with their financial support. Non-communicable diseases, or NCDs, are the #1 killer in the world today. NCDs account for 60%, that is 35 million deaths around the world. Of these, 6 million deaths are caused by tobacco. Low and middle-income countries bear a disproportionate 80% of the global NCD burden, creating a huge challenge for public health and economic development. Now, tobacco companies, with their voracious appetite for profits, have been operating aggressively in the same low and middle-income countries. What they see as a market frontier, we see as a public health nightmare. It is estimated that by the year 2030, low and middle-income countries will account for 3 out of 4 people who die from tobacco-related illness. People in low and middle-income countries suffer abuse by the tobacco industry 3 times over. First, because they become addicted and develop NCDs like cancer, heart disease, and diabetes. Second, because it is still difficult and often impossible in many countries for the average people to get the health care they need to treat the diseases they suffer from tobacco use. Third, because poor people face huge opportunity costs in spending the little money they do have on tobacco. In Bangladesh, people spend 10 times more on tobacco than on education. 10.5 million people in Bangladesh could have an adequate diet if the money they spent on tobacco was spent on nutrition itself instead. Tobacco's grip is so strong that countries have gone to unprecedented lengths to combat it. Last month, we commemorated the 10th year anniversary of the Framework Convention on Tobacco Control, FCTC, coming into force. To this day, it remains the world's only legally binding public health treaty. Last month, we saw another important anniversary. 7 years since Dr. Margaret Chan and Michael Bloomberg, in a press conference in New York City, launched perhaps the single most important public health initiative being implemented in the world today, Empower. And where governments are implementing Empower, they are loosening tobacco's grip in people's lives. Thailand has reduced smoking rates from 1 in 3 adults to 1 in 5. Brazil has reduced smoking rates by 50% using the Empower measures. But we still have a lot of urgent work ahead of us until the world is free from tobacco. In response to the challenges from our community, the tobacco industry has become more aggressive in pushing back against anything that threatens to undermine their power. In the new paper by Anna Gilmore and colleagues published in The Lancet this week, we learn more about how tobacco companies are operating in low and middle-income countries using tactics such as heavy marketing directed at non-smokers and keeping tobacco prices low until communities become addicted, and then they raise prices to turn higher profits. Using third parties that appear publicly to have no connection to the industry in order to influence policy and public perception. Disguising marketing activities as corporate social responsibility, and threatening governments who dare to stand up to them with legal action. We cannot allow this to continue. We must urge countries to stand up against the industry and implement Empower. And we must end the practice by which governments themselves are the tobacco industry. It will not be easy. You know this better than anyone else. But looking across this room at all of you gathered here today, and knowing the collective knowledge and influence that we share, I know that we will prevail. Thank you for the brave and tireless work that you are doing to bring about a tobacco-free world. And thank you for coming to Abu Dhabi for your participation in this.
Thank you for the fruitful speech you've given. Ladies and gentlemen, distinguished guests, the World Health Organization strives to raise the standards of health services globally. The WHO Eastern Mediterranean Regional Office is active from the Maghreb throughout the Middle East and Gulf and into Afghanistan and Pakistan. Therefore, it is a pleasure to welcome our distinguished guest, Dr. Ala Alwan, who is the Regional Director of the WHO's Eastern Mediterranean Office.
Bismillah ar-Rahman ar-Rahim. Your Highness, Excellencies, Excellency Minister of Health, honorable guests, ladies and gentlemen, it is my pleasure to join you here today in Abu Dhabi. This conference is unique. I am particularly pleased that this conference has the distinction of being the first venue in the Middle East to host the World Conference on Tobacco or Health. And I would like to express WHO's great appreciation to the government of the United Arab Emirates. And thank you very much, Your Highness, for a very inspiring speech. I would also like to take this opportunity to thank the organizers, local and international alike. Thank you, Your Excellencies, for attending this meeting. The theme of this year's conference is non-communicable diseases and tobacco control. And we know what we mean by non-communicable diseases. They are predominantly cardiovascular diseases, diabetes, cancer, and chronic lung disease. And as all of you are aware, these non-communicable diseases, or NCDs, are one of the most pressing public health challenges facing the world, including this region. In fact, this region has the highest rates of a number of the non-communicable diseases. One of them, of course, is diabetes. So non-communicable diseases, or NCDs, are now the leading cause of not just mortality, but premature mortality worldwide, with 82% of deaths caused by these diseases now occurring in low and middle-income countries. And of the 38 million deaths due to non-communicable diseases in 2012, 16 million, or 42%, were premature and avoidable, up from 14.6 million in the year 2000, an enormous increase in 12 years' time. And most of these deaths could have been prevented through action on tackling the 4 major risk factors for NCDs, namely unhealthy diet, physical inactivity, the harmful use of alcohol, and tobacco use. The global commitment to curbing the NCD epidemic has been demonstrated in successive landmark actions, and one of the most powerful is the WHO Framework Convention on Tobacco Control, which entered into force in 2005, and just last month, and to be exact, the 27th of February, celebrated its 10th anniversary. And the Empower Initiative, with its 6 proven tobacco control measures to support the FCTC implementation, is another landmark achievement. And most notably, there is the 2011 political declaration of the high-level meeting of the United Nations General Assembly, which took place in New York, focusing on the prevention and control of non-communicable diseases, followed by the political declaration that emerged and was endorsed by the heads of states attending this meeting. Ladies and gentlemen, we know what needs to be done, and we know what works in tobacco control. It is well documented, it is evidence-based, and it is well understood. What we need to do now is to turn the evidence and knowledge into action so as to shield more and more people, especially the young, from its well-known harms. We must closely monitor control efforts. We must protect people from second-hand smoke. We need to offer help to people to quit tobacco use. Governments must enforce total and comprehensive bans on all advertising, promotion, and sponsorship. And lastly, we must raise taxes, one of the strongest tools we have to curb tobacco use. WHO is strongly committed to supporting countries to take such actions, and it will continue to do so until our global voluntary targets are met as intended, including the tobacco use reduction target of 30% by the year 2025. So we can do more, and we can do better to protect more people from the scourge of NCDs. Ladies and gentlemen, WHO is not working in isolation. It is collaborating hand in hand with key international, regional, and national partners to empower countries and to strengthen actions at all levels. Together, we witnessed a few days ago an achievement in this region with Pakistan's announcement that pictorial health warnings will cover 85% of packaging, one of the largest warning displays worldwide. Another remarkable achievement is Ireland's adoption of plain packaging. These very recent developments mark the World Conference a true celebration of tobacco control achievements, which will change public health forever and for the better. However, there are major challenges. We're facing an aggressive, well-funded tobacco industry that is putting every possible effort into undermining tobacco control on all fronts. We are confronting a powerful alliance of octopus-like connections and powerful tools combined with unlimited resources. The more we do, the more they maneuver. We're facing new emerging products that people are not protected against. Nevertheless, we are determined to achieve our goals. We will do so through continued monitoring and persistence, making use of all the evidence and tools we have, and leveraging our strong partnerships and alliances with global and national health leaders, as well as with other international and regional organizations. The balance, I can assure you, is in our favor. Controlling tobacco is possible. In fact, it is very possible. We have seen this all over the world. At this conference, we will see evidence from Australia, Norway, Gulf countries, India, Iran, Turkey, Pakistan, United States, Uruguay, and many other countries where tobacco control has worked when the right approach was in place and the leadership was there to support it. So to the participants here today, WHO's message is that once all the elements are in place, success is achievable. And to help achieve such a goal, I am sure that this conference will underscore the vital need for rapid implementation of tobacco control policies and measures. We will not leave the world's deadliest risk factor and the commercial interest behind it free to keep taking the lives of our community members. We have to end this, and together we will do so. Ladies and gentlemen, I would like to conclude my address by welcoming His Highness Sheikh Salim bin Abd al-Rahman al-Qasimi, the representative of His Highness, ruler of Sharjah, Sheikh Dr. Sultan bin Muhammad al-Qasimi. With his presence, we are celebrating a pioneer, a true champion in tobacco control in the region. With His Highness's leadership, water pipe use has been banned in Al-Sharjah. This is a shining example, not just for this region, but for the whole world. As you all know, water pipe use is an alarming and rising trend in the region and the world. The prevalence of water pipe use among 13 to 15-year-old school students in the region ranges from 1.5% in some countries to almost 30%.